Hi, this is Dr. John Suber, plastic surgeon, and welcome to Straight Talk on Plastic Surgery, where you, the viewer, submit questions and I, in turn, answer them via video. Today's video segment is centered around an issue relating to plastic surgery in patients who have dark pigmented skin, specifically results of scarring after plastic surgery. Well, to understand the source of this question and the background a little bit, you should know that in certain groups of people and in certain families, poor scarring can run from parent to child. In other words, scarring is inherited. Just like you inherit your hair color and eye color from mom and dad, so too you inherit wound healing characteristics. Right prior to the turn of the century, in the year 2000, I believe, or near there, the human genome was mapped out, and I believe that over the next 20 to 30 years, as details of information along those chromosomes is identified, we'll find more information about exactly how wound healing is inherited, but right now we just appreciate that it is without knowing a great deal of detail about it. In the black populations and in some Hispanic populations as well, keloids can be inherited. This isn't for all members of any particular group, but it tends to run in families. Many people know historically whether or not they form keloids, as they can occur anywhere where an incision is made. Even in ear piercings, people can get swollen areas that look like a cauliflower head, where the scar spills beyond the confines of the initial scar. That is a keloid. I should take this moment also to note the difference between a keloid and what's called a hypertrophic scar. Anybody can form a hypertrophic scar. Some of that is inheritable. Other things, issues have to do with where the scar is, whether there's direct trauma from clothing or some other source, tension due to scar over a joint. All these can contribute to hypertrophic scars, and hypertrophic scars are simply scars that have a ropey appearance, that are thickened and raised. Keloids, again, tend to spill beyond the confines of the original incision. The important point there is that under the microscope they both actually are the same thing. They're excess production of collagen. But suffice to say that in plastic surgery, patients who have a known history of keloids and or hypertrophic scars do warrant special consideration. With regards to keloids, knowing a patient ahead of time has that, a lot of preoperative discussions have to be had with the patient so that they understand that this risk is something that's in their genes that we cannot alter or manipulate, although to some degrees the risk of those keloids can be lessened through proper handling of the tissue, minimizing trauma, and even adding a layer of treatment via potential intraoperative or postoperative injection of steroids along the scar and or even local low-dose radiation to scars. Any and all of those options and others are available, including silicone sheeting and compression dressings, but all those need to be discussed at length with a well-trained, well-qualified, experienced plastic surgeon. When I know a patient has a history of keloids, we will discuss, depending on the nature of the surgery, tummy tuck abdominoplasty, small malignant skin cancer, lesion removal, other type of procedure, the way that we manage that prophylactically with treatment ahead of time will vary from patient to patient, and that really can't be discussed honestly unless it's a face-to-face consult with a plastic surgeon. Many times we get patients who come in with keloids and hypertrophic scars from other surgeries, and we're asked to address and revise them. It's at that point where I give serious consideration to not only possible steroid injections along with cutting out the scar and closing it up again, but also low-dose radiation. Don't be scared by that term. It's actually quite safe in the large majority of cases, and when that is a tool that is good for a patient in particular, we partner with the radiation physician who manages that very closely. part of improving scars can be a simple matter as revising the scar and keeping the tension or the tightness of it deeper in the tissue and letting the skin just barely touch together. But the main thing is that a plastic surgeon who's well trained and well experienced will understand all of these principles and will be able to tell you which ones apply to you. The bottom line is, if you are fearful of having keloids and are in one of these ethnic risk groups, don't be afraid if you don't have a history of that. Are your ears pierced? Have you had problems there? Have you had other incisions or even bug bites that have whelped up? Those are risk factors, but don't necessarily mean, number one, that they will occur again. And just because a relative has had an issue doesn't mean necessarily you will. So again, that's where the face-to-face consult with your plastic surgeon is going to be key. I hope that this helps address the question regarding that. In summary, I will say that if you are a very strong candidate for a given procedure, keloids run in your family or you've had them before, they can occur again. So that's where you're going to take the benefits in one hand of a procedure, the risks of the other, and you're going to weigh them out and see which way you want to fall with the help of your physician who will be navigating that decision for you. You, the patient, will be making the final decision in many cases. So if you're a keloid former, it doesn't mean I would completely rule out a potential procedure that you're a very good candidate for, but you need to have a frank conversation with your plastic surgeon. So I hope this information has helped address your questions. If you have others, please send them to me. Don't forget, send them to me via email so there's the best chance of me to be able to review those questions and get you an answer. In the meantime, remember, no matter where you are, life is good.